Every once in a month, they travel from their villages, some on foot and a good number on bicycles. Among them is 22-year-old Simon Owuma from Aloro North and Susan Angom, a senior 3 school dropout from Aloro South in Kitgum district. Like students, they sit in class and review the information they have got from the field, and a health worker takes them through what they need to do. They are not qualified medical workers. They are simply members living within the community, some of whom have not even attained any education at all. But these people have become quite a force to reckon with in the health service provision in the country. They are the village health team workers. And the Ministry of Health is not blind to this fact.
We give them some medicine boxes to carry the medicine, the first aid medicines. We give them literature to read, basic information about healthcare, and some T-shirts for identification. We give them bicycles through many programs. It's likely that each village health team will be having about 3-4 bicycles.
A village team has about 7 members. Simon has a bicycle from the Ministry of Health, but the bicycles are not for all, so transport is still a problem. Susan rides a borrowed bike.
You fought door to door. By coming back home, we are tired. We cannot finish the work one day.
In a week, she visits between 5 to 7 households of the 31 she has to see each month.
When the rain, that is the most problem. And the bike cannot ride. We just struggle on barefooted. Even our shoe cannot work well there.
Health workers at the centers like Olyankul Kwach Health Center too most often do not see people like expectant mothers who do not come for antenatal care.
Most of the mothers, they go out for their garden works. So when they go for their garden works, they tend to forget to come to the health facility or to bring their children for immunization.
This is where village health teams are most needed. But even for the likes of Simon, this is one of the biggest challenges.
The mother from there, they send us as children without them, and they are very serious working in the garden.
This makes them get less detailed information because the little ones sent to them cannot divulge all the details. Now, the Ministry of Health says that the issue of voluntarism has got to be evaluated as it is not a permanent issue in human interventions.
Some people will come up and demand to be paid.
And indeed, some NGOs like World Vision are now liaising with the districts to use these volunteers in their projects by paying them 10,000 shillings each once a month when they meet.
The one big challenge is that the VHTs who do the nitty-gritties of the work, currently government is recruiting them as volunteer. He has his garden or she has her garden, she has other things to do, but the work is too much. If she has to follow up 30 households, and at the end of the month, he or she is not being paid.
But the ministry fears that the kind gesture by the NGOs, despite them working with the districts, may spark off a strike among volunteers who received nothing.
We are not allowed as NGOs to pay them because it's not sustainable.
So for harmonization, it's important that the NGOs and partners who are doing it should come to us so that we work about it together.
The ministry is soon to complete VHT formation in the country, with the next step being quantification to see how much can be extended to them, despite not having prepared funds for them.
But I want to remain open to say that when it comes to release funds where it creates impact, then we should release money to them. And as far as we are concerned, they are doing some intervention that are helping us to perform.
We need them to just to look for any reward.
There are about 57,000 villages in the country, and the Ministry of Health ensures that each village gets 7 village health workers volunteering to carry elementary health messages. In 90% of the districts, these teams are there to see to it that all remote areas are reached. They are, however, serving big populations. In Kitgum district, there are about 650 of them, serving a population of over 250,000 people. For some people, voluntarism has a limit, especially in a country where most people are poor, with families to take care of. Florence Nalimba, NTV Kitgum District.